It then passes between the two heads of origin of this muscle and enters the fossa. The third or pterygopalatine portion lies in the pterygopalatine fossa in relation with the sphenopalatine ganglion. The branches of this vessel may be divided into 3 groups, corresponding with its 3 divisions. Branches of the first or mandibular portions: anterior tympanic, deep auricular, middle meningeal, accessory meningeal, inferior alveolar. The anterior tympanic artery, A. tympanica anterior, tympanic artery, passes upward behind the temporomandibular articulation, enters the tympanic cavity through the petrotympanic fissure, and ramifies upon the tympanic membrane, forming a vascular circle around the membrane with the stylomastoid branch of the posterior auricular, and anastomosing with the artery of the pterygoid canal and with the caroticotympanic branch from the internal carotid. The deep auricular artery, A. auricularis profunda, often arises in common with the preceding. It ascends in the substance of the parotid gland, behind the temporomandibular articulation, pierces the cartilaginous or bony wall of the external acoustic meatus, and supplies its cuticular lining and the outer surface of the tympanic membrane. It gives a branch to the temporomandibular joint. The middle meningeal artery, A. meningia media, medidural artery, is the largest of the arteries which supply the dura mater. It ascends between the sphenomandibular ligament and the pterygoideus externus, and between the 2 roots of the auriculotemporal nerve to the foramen spinosum of the sphenoid bone, through which it enters the cranium. It then runs forward in a groove on the great wing of the sphenoid bone, and divides into 2 branches, anterior and posterior. The anterior branch, the larger, crosses the great wing of the sphenoid, reaches the groove or canal in the sphenoidal angle of the parietal bone, and then divides into branches which spread out between the dura mater and internal surface of the cranium, some passing upward as far as the vertex, and others backward to the occipital region. The posterior branch curves backward on the squama of the temporal bone, and, reaching the parietal some distance in front of its mastoid angle, divides into branches which supply the posterior part of the dura mater and cranium. The branches of the middle meningeal artery are distributed partly to the dura mater, but chiefly to the bones. They anastomose with the arteries of the opposite side, and with the anterior and posterior meningeal. The middle meningeal on entering the cranium gives off the following branches. 1. Numerous small vessels supply the semilunar ganglion and the dura mater in this situation. 2. A superficial petrosal branch enters the hiatus of the facial canal, supplies the facial nerve, and anastomoses with the stylomastoid branch of the posterior auricular artery. 3. A superior tympanic artery runs in the canal for the tensor tympani and supplies this muscle and the lining membrane of the canal. 4. Orbital branches pass through the superior orbital fissure or through separate canals in the great wing of the sphenoid to anastomose with the lacrimal or other branches of the ophthalmic artery. 5. Temporal branches pass through foramina in the great wing of the sphenoid and anastomose in the temporal fossa with the deep temporal arteries. The accessory meningeal branch, ramus, meningeus accessorius, small meningeal, or parvidoral branch, is sometimes derived from the preceding. It enters the skull through the foramen ovale and supplies the semilunar ganglion and dura mater. The inferior alveolar artery, A. alveolaris inferior, inferior dental artery, descends with the inferior alveolar nerve to the mandibular foramen on the medial surface of the ramus of the mandible. It runs along the mandibular canal in the substance of the bone, accompanied by the nerve, and opposite the first premolar tooth divides into two branches, incisor and mental. The incisor branch is continued forward beneath the incisor teeth as far as the middle line, where it anastomoses with the artery of the opposite side. The mental branch escapes with the nerve at the mental foramen, supplies the chin, and anastomoses with the submental and inferior labial arteries. Near its origin, the inferior alveolar artery gives off a lingual branch, which descends with the lingual nerve and supplies the mucous membrane of the mouth. As the inferior alveolar artery enters the foramen, it gives off a mylohyoid branch, which runs in the mylohyoid groove and ramifies on the undersurface of the mylohyoideus. The inferior alveolar artery and its incisor branch during their course through the substance of the bone give off a few twigs, which are lost in the cancellous tissue, and a series of branches which correspond in number to the roots of the teeth. These enter the minute apertures at the extremities of the roots and supply the pulp of the teeth. Branches of the second or pterygoid portion: deep temporal, pterygoid, mesenteric, buccinator. The deep temporal branches, 2 in number, anterior and posterior, ascend between the temporalis and the pericranium. They supply the muscle and anastomose with the middle temporal artery. The anterior communicates with the lacrimal artery by means of small branches which perforate the zygomatic bone and great wing of the sphenoid. The pterygoid branches, rami pterygoidae, irregular in their number and origin, supply the pterygoidae. The mesenteric artery, A. mesenterica, is small and passes lateralward through the mandibular notch to the deep surface of the masseter. It supplies the muscle and anastomoses with the mesenteric branches of the external maxillary and with the transverse facial artery. The buccinator artery, A. buccinatoria, buccal artery, is small and runs obliquely forward between the pterygoideus internus and the insertion of the temporalis to the outer surface of the buccinator, to which it is distributed, anastomosing with branches of the external maxillary and with the infraorbital. Branches of the third or pterygopalatine portion: posterior superior alveolar, infraorbital, descending palatine, artery of the pterygoid canal, pharyngeal, sphenopalatine. The posterior superior alveolar artery, A. alveolaris superior posterior alveolar or posterior dental artery, is given off from the internal maxillary, frequently in conjunction with the infraorbital just as the trunk of the vessel is passing into the pterygopalatine fossa. Descending upon the tuberosity of the maxilla, it divides into numerous branches, some of which enter the alveolar canals to supply the molar and premolar teeth and the lining of the maxillary sinus, while others are continued forward on the alveolar process to supply the gums. The infraorbital artery, A. infraorbitalis, appears from its direction to be the continuation of the trunk of the internal maxillary, but often arises in conjunction with the posterior superior alveolar. It runs along the infraorbital groove and canal with the infraorbital nerve, and emerges on the face through the infraorbital foramen, beneath the infraorbital head of the quadratus labii superioris. While in the canal, it gives off A. orbital branches which assist in supplying the rectus inferior and obliquus inferior and the lacrimal sac, and B. anterior superior alveolar branches which descend through the anterior alveolar canals to supply the upper incisor and canine teeth and the mucous membrane of the maxillary sinus. On the face, some branches pass upward to the medial angle of the orbit and the lacrimal sac, anastomosing with the angular branch of the external maxillary artery. Others run toward the nose, anastomosing with the dorsal nasal branch of the ophthalmic,